Hello everybody, this is Pejman Pirmoradi and this is my seventh program from video series called Our Health System. The title of this program is Branding and Price Cap. You have noticed that there is not such a thing as legitimate pricing for anything in our health system. You go ask help and you ask about the cost and they tell you, here is your out-of-pocket cost, here is your deductible, and we will send you the bill. Eventually you receive your bill, you look at your medical bill, you're shocked because it's outrageously high. And another source of frustration is you look at your medical bill and you cannot make sense of it. And this is the routine problem, source of frustration, anger, and anxiety for almost every household in this great nation. It wasn't like this before. I told you from 1939, our health system slowly shifted from not-for-profit towards full profit, from patient-centered patient care to money-making machine and profit-centered. Smaller hospitals slowly disappeared. They were bought by bigger corporates, bigger health systems emerged, and this gigantic system started to creating their own master price list. This master price lists are top secret privileged information for any healthcare in this country, for big hospitals and corporates. They are not by law required to disclose them, and these are again privileged information. And prices all over the place based on the type of the plan and service that you get, the places you go, your out-of-pocket deductibles and premiums are different. Let me give you some examples. Let's compare to about the cost of the services in our country compared to other countries. Let me give you an example. Like MRI. MRI, average cost of an MRI in the US is about $1,100. In a country like Australia, is about $215, and in Netherlands is about $450. Average nightly hospital stay in hospitals in US is about $5,200 per night, and average stay nightly in a hospital in Australia is about $760. Let's go to natural delivery. Natural delivery in hospitals in the US ranges, again, based on the service, based on the plan, based on the location, prices are all over the place. The range of a natural delivery could be from $3,000 all the way through $37,000, and it's outrageous, and there's no way you can justify this price range for this system. Again, these brandings that they create, their own brand of the corporate, their own brand of hospitals entitles them to come up with their own pricing, and it's up to you to come up with the money. Average C-section cost, cesarean section for child delivery in the hospitals in the US ranges from $8,000 all the way to $71,000. Again, how you can justify that? It's a wild, wild world out there. So several governments came out for decades, tried to put mandates, put amendments to try to help me and you in this broken, utterly broken, non-fixable system. Because it's non-fixable, because the foundation is wrong, no matter how many amendments they put forward, they're not going to help me and you, because the foundation is a for-profit system. That has to be fixed. Example is Affordable Care Act by President Obama, and another bill called Affordable and Safe Prescription Drug Importation Act. because if you remember from my previous video clip, number 6, I talked about the drug prices, the price gouging for the drugs in the US compared to other countries. We are paying the highest in the world. And their solution is, in this bill, to me and you, to legalize for me and you to buy online prescription drugs from countries like Canada. And they made this into law, and it has not been fully implemented yet. But don't you think this is not a fix to this utterly broken system? This is not going to help. And by the way, insulin is excluded from this bill. Let me give you an example why this is outrageous, to make it easier to understand for some people. Imagine you live in a city, that this city is filled with crimes, killings everywhere, robberies everywhere. You're afraid to get out of your house. And the chief of police one night comes out and on the TV and it tells you that I have a solution. If you go through this alley, when you go to your work and you go outside the house, you'll probably be safe. But if you get out of this alley, you're on your own and you might get killed or you might get robbed. And you're lucky enough, you turn off your TV, you look at that announcement from the chief of police, you are at the mercy of the horrible situation in that city. That's the situation we have with our healthcare. We are hopeless. We are filled with fear, with anxiety, with frustration, and this is what they offer. Looks like they already given up. They don't know what to do with the system. They ask other countries to send us cheaper medications. And Justin Trudeau, the Prime Minister of Canada, yesterday came out and he said he's going to ban this, exporting Canadian drugs to America when they need these essential drugs for their own people. We cannot blame them, because they are trying to protect their own people. We have to fix our foundation. It's outrageous, and this is not the way to deal with the problem, as the example that I mentioned to you. So that is not the solution that we are looking for. And I told you the solution would be very simple. Medicare for all, universal health care or national health care, whatever you may call it. It's a single payer system, transparent, inclusive, and humane. It's a basic human right. This government or any other government that comes before or after this, they need to understand this is the matter of life and death for humans. This is inhumane for so many Americans after COVID to be out of insurance, to have no protection. And thousands of people are dying. More than 200,000 people are dying every year in this country due to not be able to afford, because they cannot afford. And this is outrageous and this is inhumane. This has to change. Let me read you a quote from a doctor. He is a professor of health policy from Johns Hopkins University. His name is Dr. Marty McCary. He says, and I quote, "This predatory billing and price gouging is threatening the great public trust in American medicine." That's what has happened. What is happening every day? People are losing trust in the health system. People are losing trust in the physicians. People are afraid to go to see a physician because they cannot afford it and they cannot trust the system. This is a rigged for-profit system. So we need to change this, and we need to do whatever we can. Every single citizen is responsible. We are responsible for our own safety, for our children, for our families, for our community, and for our nation, to force the government to provide this basic human right for every single American. Medicare for all, healthcare protection for all Americans, which is only a basic human right and only way to go. Not all these amendments and all that. That's all I have today, and thank you so much for tuning in. And you're gonna have to change this system. Nothing is impossible. We are going to change this system. I'm optimistic because I'm hopeful that with people's power, anything could be accomplished. Thank you so much. I'll see you next time. Okay, bye-bye.